Okay, I'm going to continue talking about synapses, and part 3 here is going to be about the chemicals. So those, what we typically call neurotransmitters, and I've been calling neurotransmitters so far, and I always try to call these neurochemicals because sometimes we use those kind of interchangeably, and truly some of these are not neurotransmitters per se, but it's okay, whatever we call them. I'm including this picture from Laura Freeberg's Discovering Behavioral Neuroscience because I like the way that things are broken down here. I find the colors and the changes helpful for my memory and kind of grouping things together, but it is mostly overlapping with what is in your textbook. And so I have the table from your textbook on the next page, and that's what you really want to know, but this helps me. So just whichever way helps you to learn. Here's the table from your author, that textbook, and again, for me, it's whatever helps you to put this all together in your head, and whatever you remember the most, you're gonna be fine. And he has a few different ones included, and I'm not sure I talk about others in there. I don't really talk about the purines other than adenosine, and I don't talk about it as a purine. I don't talk about aspartate at all, I think. Maybe just a teeny tiny bit, but not where you need to know it. So it just depends on what you feel comfortable with putting into what you want to remember as part of these neurochemicals. As I stated before when I was talking about the chemical events at a synapse, so those neurotransmitters or neurochemicals are going to have this lock and key kind of mechanism where the neurochemical has to fit into the receptor site, like the key. And as we're going to talk about drug effects here and there, I'll be using the words agonist versus antagonist, where an agonist, this says it mimics the neurotransmitter action, but really it's enhancing the neurotransmitter action is probably a better way to say that, because there are different ways. It can directly mimic and fit in like the neurotransmitter does, fit into those receptor sites and alter the postsynaptic neuron, but it can influence those neurotransmitters being synthesized. It can enhance their action in multiple ways, which I think I'm going to talk about briefly, but if you have questions about it, definitely ask me. There are multiple ways to be an agonist. Drugs can act as antagonists as well, so opposing the action of a neurotransmitter or a neurochemical. So just to make sure I say this at some point, it's not that an agonist is excitatory and an antagonist is inhibitory, because remember, the neurochemicals themselves can be excitatory or inhibitory, so that's not an appropriate way to discuss agonists and antagonists. And as I said for agonists, the antagonists too, they can work in a number of ways. The easiest one to talk about is that still fitting into the receptor site, like the key of the lock, but not altering the postsynaptic neurons. So that's going to just block the neurotransmitter or neurochemicals from getting into those receptor sites, acting as an antagonist. But again, can happen in several different ways. So as I start with talking about the neurotransmitters, you remember acetylcholine was listed at the top of the one figure that had all the colors with it. And it is a really important small molecule. It is phylogenetically old, and we see it in many. In fact, I'm not sure that we have any life forms that we don't see acetylcholine in. Acetylcholine has a number of functions in our nervous system. One is that it controls every move we make. So walking, running, typing, everything that we're doing, me sitting here talking to you, that is all because there is acetylcholine being released by those motor neurons controlling the skeletal muscles of, right now, my mouth and also my hands, because I talk with my hands quite a bit. This is the only neurotransmitter between motor neurons and voluntary muscles. Okay, we also have acetylcholine in the brain itself, so it's contributing to the regulation of attention, arousal, and memory. There are some acetylcholine receptors that are stimulated by nicotine, and these are actually called nicotinic
receptors. And we see various disorders associated with the dysregulation of acetylcholine. The most kind of, I think, the easiest one to talk about without getting into kind of the balances between some of these neurochemicals that occur is Alzheimer's disease. So what we see is less acetylcholine, especially in the hippocampus, as people are getting Alzheimer's disease, and as they're getting worse and worse along their trajectory. In Alzheimer's disease, we see fewer and fewer of those acetylcholine receptor sites and less acetylcholine being released. So what this means as far as which one of these things is causing the other, remember that when we're talking about brain activity or neurotransmitter release, we are talking about a correlation. So we don't know if it's less acetylcholine is causing Alzheimer's disease, or we have this Alzheimer's disease that's causing us to have less acetylcholine, or if there's a third variable really affecting both. One thing, so I'm going to tell a couple of stories about neurotransmitters here. Again, hopefully to help you remember them. If the myasthenia gravis, if you remember, that was talking about acetylcholine. I have had a friend who, she was hit by a car while she was in her car, and she did some damage to her brain and to her hip. And so she had brain damage and she couldn't move very well. So she was bedridden for a while. And she also ended up getting, pretty soon after that, finding out that she had lung cancer because of the fact she really smoked a lot of cigarettes. She smoked a lot. And so with all of that together, her doctor ended up prescribing her choline, which is the amino acid that becomes acetylcholine. If we're taking in, so if you're eating your farm fresh eggs that are cage-free farm fresh eggs, they're going to have more choline in them. And so this is one way to get more choline into your system. Now, I've said this to a colleague of mine who's been in this field for a long, long time, and she said, well, there's so much choline in the body that I'm not really sure it matters. But for someone like my friend who was not moving around much and who used to smoke cigarettes and who had this brain damage, but the choline was expected to help her to maintain some of her brain activity. What we could do for people with Alzheimer's disease is less clear if we're talking about helping them through upregulating their acetylcholine. It's not as clear that would be helpful. So I am going to go back to that if you did not listen to the myasthenia gravis and what was happening, or you didn't understand, maybe listen to this and go back and see if you understand that what happens in our body. Okay, and acetylcholine is a great example to talk about. That we have these constituent substances, so the amino acid choline, and we have this other substance acetate, and so they are A and B separately. And there's another enzyme in our body that's going to help put those together. So in this case, it's choline acetyltransferase. I kind of laugh sometimes at some of these terms. It's a mouthful, but choline acetyltransferase puts those two constituent substances together so that we get the big AB that I'm trying to show you at the other side of that equation-like thing, which is acetylcholine. And if you remember from the example with the myasthenia gravis, that we have this enzyme in the brain that is acetylcholinesterase that then pulls that substance apart into those two constituent substances, and then the presynaptic neuron in this case is going to take back up the choline and put it back together with acetate that's in the neuron. So we have these enzymes kind of doing this job of putting together these constituent substances to get a more complex substance, and also different enzymes that are going to pull those apart. And this is not something you need to memorize. It's just something that it's good to understand, I think, as we're moving forward, and especially if you're going to move on from this class into some kind of neuroscience or medicine or whatever, that this is how it works. Okay, glutamate is another neurotransmitter that I have in the back of my head as being very phylogenetically old, meaning it's in pretty much all the animals that we see. It serves as a widely distributed excitatory neurotransmitter. It's involved actually in a lot of systems, but we're going to talk about it specifically when we talk about learning and memory in this class when we get to that section. It's also involved in autonomic nervous system reactions. One of the disorders that we see associated with dysregulation of glutamate is schizophrenia. So these people have fewer glutamate receptors in various areas, especially in the hippocampus and the prefrontal cortex. And that's just one of the, again, correlations that we see. GABA, which is usually called GABA, but it stands for gamma aminobutyric acid. This is a widely distributed inhibitory neurotransmitter. Okay, it lowers arousal, it lowers anxiety, it lowers excitation, it facilitates sleep. So one of the probably best known disorders associated with any dysregulation of GABA are all the anxiety disorders, but especially those that are more generalized, where I just have a lot of anxiety. But even pain is influenced by our having less GABA in the system. So if we look at the drugs that are used for helping people with anxiety, Valium, diazepam, similar kinds of anti-anxiety drugs, they are working at GABA synapses. They are GABA agonists. We also see that alcohol indirectly increases activity at synapses that release GABA. So this kind of really lowering anxiety, but then we can also, as I'm going to show you when we talk about the development of the brain, that if we're lowering GABA enough, we can lower the kind of the communication between neurons to the point where we can kill neurons. So it is something to be careful with. Dopamine contributes to the control of voluntary movement. And you might say to yourself, well, that was what acetylcholine was doing. But acetylcholine was working from the motor neurons to the skeletal muscles themselves. Dopamine is in that part of the brain. So especially in the basal ganglia, we're going to talk about dopamine quite a bit when we talk about movement and the basal ganglia. We have another kind of dopamine pathway going through the medial forebrain bundle, characterized as the reward pathway. And that's the pathway that continues up into the prefrontal cortex. Okay, so if we have too little dopamine in that reward pathway, we're likely to have some kind of addictive disorder, because it's kind of like our brain is not giving us the reward for things like doing well on a test, or getting someone saying that we did a good job at something, doing those external things that we might be rewarded for. If we don't feel that enough, given our brain chemistry, and especially if we take any kind of drug, we might be very likely to become addicted, because those drugs, they kind of hijack that reward pathway. Other disorders, we're going to talk, when we talk about movement disorders, going through that through the control of voluntary movement, through that a striatal pathway, it's going to be the Parkinsonism and Huntington's disease. All of those are really from having too little dopamine in different pathways, and those that dopamine is being synthesized in different areas. Schizophrenic disorders, they have a different problem where they have it looks like too much dopamine, and that does have this kind of relationship with glutamate. But that too much dopamine, they usually, if they're taking medicine to help them with their schizophrenia, they're taking a dopamine blocker. Okay, cocaine and amphetamines elevate activity at dopamine synapses specifically and directly. Cocaine also interferes with the process of reuptake. In a couple of places, I put in this biosynthesis so that You are aware that there is this biosynthesis. This is what I was doing with the equation-looking thing before. I don't ask you anything specific about the biosynthesis, but I think it's important to get at least exposed to this at this level in your education. So if we look at the biosynthesis of dopamine and norepinephrine, it starts with tyrosine, which is a conditionally essential amino acid. Sometimes we can get this, so tyrosine from phenylalanine, which is an essential amino acid, meaning we have to get it from our diet. But tyrosine, we do have some of this in the body. That tyrosine, in its synthesis, this enzyme, tyrosine hydroxylase, gives it or allows it to receive a hydroxyl group. It becomes L-DOPA. Then through DOPA decarboxylase, it loses a carboxyl group and becomes dopamine. Okay, so these are, I'm just showing you again that we have these constituent parts. We have this enzyme doing this job of putting those constituent parts into a more complex constituent. And then, so we become something like dopamine, which we're going to be using as a neurotransmitter in the brain. And actually, norepinephrine and epinephrine are created from dopamine. So we have dopamine, it receives a hydroxyl group given this dopamine beta hydroxylase, and it becomes norepinephrine. Okay, and again, you don't need to know any of that. I'm never going to give you a biosynthesis or ask you to do the biosynthesis, but I think it's important at this point to be exposed to how this works. So now talk about norepinephrine, as we've gotten there through our biosynthesis. It is also pretty widely distributed throughout different brain regions. It contributes to the modulation of mood, arousal, and vigilance, which, as you can imagine, since it's affecting mood, arousal, and vigilance, it necessarily contributes to attention, and our attention particularly to new or important stimuli. It's also implicated in memory, which makes sense because it has this effect on attention, and attention is necessary. We need to pay attention to things if we want to remember them. Cocaine and amphetamines also elevate activity at those norepinephrine synapses. And if we look at disorders associated with the dysregulation of norepinephrine, depressive disorders are a possibility. So depending on, usually, and I'm going to talk about serotonin soon, usually what they do with depression as a first line of defense is try some kind of selective serotonin reuptake inhibitor. If that doesn't help, they try a selective serotonin and norepinephrine uptake inhibitor, so reuptake inhibitor. So it's clear that these monoamines have some influence on depression, and it looks like one important monoamine is norepinephrine.
For epinephrine, you can see in the biosynthesis that it comes from norepinephrine, and this is a more simplistic biosynthesis chart that I think is from your textbook. In the brain, we talk about epinephrine, the neurochemical or the neurotransmitter, as epinephrine, but in the body, as this hormone produced by the adrenal medulla, we talk about it as adrenaline. So the nomenclature is a little confusing, as they also talk about adrenergic neurons producing the epinephrine, but in the brain, it is often being used at the same time as norepinephrine, and it's considered to be less important than norepinephrine. So it's not talked about a great deal as being in the brain, and when we talk about it in the body as a hormone, we call it adrenaline. It is involved in the regulation of eating as well as regulating our blood pressure.
So the last, I think, neurotransmitter I talk about, although I think I still have my gasotransmitter, is serotonin, which is sometimes shortened as 5-HT. I always have the shortened version there in parentheses. I've been forgetting to say that, but they are there for you in case you see them in writing or wherever you see them. It is involved in the regulation of sleep and wakefulness, eating, and aggression. So one of the disorders associated with dysregulation of serotonin is depressive disorders. And I've already alluded to this, and I think for most people, their understanding of antidepressants are these SSRIs that are selective serotonin reuptake inhibitors. I'm inhibiting the reuptake into that presynaptic neuron, with the logic being I'm allowing that serotonin to stay in the synaptic cleft for longer so that it can have more of an effect on the postsynaptic neuron. And that's probably the most typical antidepressant anymore. Although, again, it's kind of our first line of defense, and it really only helps about 30% of the people, or maybe even fewer. I think it's all of the different drugs together. We have about 30, maybe 40% of people that we are helping with the basic drug regimen, drug therapy. Serotonin's also been implicated in some anxiety disorders, and especially in obsessive compulsive disorders. Although, if you're following your DSM, I think they took obsessive compulsive disorders out of the anxiety disorders, which I find a little bit, I don't completely know that I agree with, because anybody who has obsessive compulsive disorders will tell you it causes anxiety, and anxiety is the reason I need kind of help with all of this. We also see a dysregulation in people who have eating disorders, and so sometimes people who are anorexic, they will prescribe an SSRI for those people. And so some of this, when we talk about some of these things, eating is part of this whole thing. Sleep and wakefulness is very influential in all of these things, in anxiety and depression and so forth. And aggression and depression are very related in their own, and they're kind of like flip sides of the same coin in my mind a lot of the times. Prozac and similar antidepressant drugs, again, affect serotonin, as that's what I've been talking about with the SSRIs, or the selective serotonin reuptake inhibitors.
I'm not going to go through the whole biosynthesis. There it is for you, but I'm going to talk a little bit about the start of the biosynthesis, starting with tryptophan, and that it ends up with that 5-hydroxytryptamine, which is the 5-HT, or what we sometimes shorten serotonin to be being called 5-HT. So tryptophan, and why I want to do this beginning, is because it is an essential amino acid. There are people who have enough kind of genetic likelihood to become depressed that even a low tryptophan diet can cause some amount of depression in them. This is kind of how I feel. I know that I have depression for other reasons, but I know that I need those proteins in my diet, and we do get tryptophan from the high proteins, from fish, eggs, chicken, tofu, nuts, things that are high in protein. For this slideshow, my so-called summary, sometimes I don't do very good summaries at all, but I'm going to put back up this chart of neurochemicals to just say, so here's where we've been. Acetylcholine, the monoamines, catecholamines, and indolamines that both fit under the monoamines. We've also talked about glutamate and GABA, so some of those amino acids we'll get to, glycine as well. And so we have not talked yet about the neuropeptides or the gasotransmitters, but this is a nice place, I think. Well, for timing, I need to stop, but this is a nice place to put back up this chart and have it as a kind of summary. And again, so you can kind of place in your mind where these things, how these things affect us, and then where they belong in our chart of neurochemicals.